My name is Lydia Christina. I am of Dominican background. My parents are both Dominican. I was born in the Dominican Republic and was brought to the United States at 3 when my father, who was a revolutionary in the times of Trujillo, got political asylum. And so through political asylum, we became Americans. I am native of New York, lived in New York all my life, graduated from John F. Kennedy High School in New York, and then went to college. I am a physician by education, but my father, who was a businessman, always said that when I had finished my career, we would open a clinic. And in order to run a clinic, run any business, you had to know business, so he made me study business. So I am also a business administrator, besides being a physician, which has come in very, very handy in this New York and this US healthcare world in which it is as much a business as it is about patient care.
Mi nombre es Gloria. I'm the Executive Vice President of Operations at SOMOS Community Care. Well, I was born in Hong Kong, so Hong Kong was a British colony at that time for 100 years. So I didn't have a chance to learn Mandarin. That's why my Mandarin is so poor. I speak perfect Cantonese, and I can understand a little bit about Taishan. Taishan is the oldest language in Chinatown area. I don't know if you guys know, I was a US correspondent for Hong Kong government, and I was a reporter, like freelance reporter for BBC. And also news, that's my hobby. I love to do news. And my hobby is, I think most of you know, I play a different musical instrument. I can play piano, violin, harmonica, and some more. I have been in healthcare industry for many, many years. I am 27 years old. I wish. But I've been in the healthcare industry for many years as a leadership role. I in charge sales, marketing, providers operations, and operations. So in a different area. So I kind of learn a different areas in the healthcare industry, and it helped me to grow my career because I need those. I need a knowledge to oversee a big group like SOMOS. And I see SOMOS is growing so fast in the 4th years, right? SOMOS is different than what I used to work at. I used to work at the 500 big corporations. SOMOS relatively is smaller than the big corporations, but I like the environment because we are so close. We can go to talk to our CEO, Mario. I can just lock on the door and talk to Mario. But in a big corporation, you need to go through so many channels, and it's not easy to get one thing done. I mean, SOMOS is more flexible. You can talk to upper management. We have an open door policy, so you can just lock on the door and you can get the problem resolved.
My name is John Dionisio, CIO of SOMOS Community Care. I was born in the Philippines, I grew up in Florida, and I've been here in New York for about 12 years now. Before SOMOS, I was working very closely with the IPAs, some of the providers in the network, I've been working with for a long time. And even prior to that, when I was on the payer side, I worked very closely with this network. I enjoy grilling, right? So there's a lot of very technical things with grilling in terms of the time, the heat, the temperature, so you can really turn this into a science. That's a lot of things that I like to do here.
My name is Liz Webb, and I am the Vice President for Human Resources here at SOMOS. I was born in Alabama, came to New York for a job because somebody promised me a job double my pay. What they didn't tell me was the cost of living was double also. So that's how I left Alabama many years ago. My passion is the theater, acting, singing, and dancing. As SOMOS actually is just a pit stop for me. I'm on my way to the Oscars, the Emmys. So anybody there that has my signature, keep it, because one day it's going to be worth something. What I like about working at SOMOS is the mission. Being able to help people, to help as many people as possible, with navigating the healthcare system.